You will be offered various screening tests for the baby apart from the first trimester scan. Screening tests are done to find out the risk of baby having birth defects. They include a blood test and a first trimester scan. Your first scan, usually done at 12 weeks, is also known as a dating scan or NT scan. During the scan, you will come to know if you're carrying twins or a singleton pregnancy. This scan also tells if the pregnancy is located in the right position or not. And this scan is considered the most accurate for calculating the due date of your delivery. It will be the most exciting time for you as well. You will see your baby for the first time. Sonographer will also show you the baby and his heartbeat. For the screening purposes, during the scan, sonographer will measure nuchal thickness. It measures the thickness of the area of the back of the baby's neck and is considered abnormal if the thickness is increased. Along with nuchal thickness, you will be offered blood tests for the screening purposes. These blood tests are done to detect certain genetic conditions in your baby. The most commonly tested genetic conditions are Down syndrome, trisomy 18 and trisomy 13. Two types of screening tests are offered. First trimester combined screening, which combines the result of blood test and NT scan. And the second trimester quadruple screening, which offers the blood test in second trimester. Coming to first trimester combined screening, it is usually done between 11 to 13 weeks of your pregnancy. As usual, it will involve a blood test and a special scan known as NT scan, which we have already discussed. Blood tests check the level of hormones like beta-HCG and PAPA. NT, known as nuchal thickness scan, is done between 11 weeks and 5 days to 13 weeks and 6 days. As discussed earlier, it measures the thickness of the area of the baby's neck and is considered abnormal if the thickness is increased. You will get combined results from blood test and the scan, which will tell you the chances of your baby having Down syndrome or certain other genetic conditions. These tests have 90% detection rate. Second trimester is a blood test which is done between 15 to 18 weeks. Integrated serum test combines the result of first and second trimester screening. NIPT, also known as non-invasive prenatal testing or cell-free fetal DNA testing. It is the newest form of testing available and is done around 10 to 11 weeks to examine baby's DNA in your blood. It detects 99.5% cases of Down syndrome, 97.7% cases of trisomy 18, and 96.1% of trisomy 13. This test analyzes small fragments of DNA which are shed from placenta and are found circulating in mom's blood. This DNA shed from placenta is similar to baby's DNA. This test provides a very good opportunity to detect certain chromosomal conditions. So what actually are chromosomes and why everyone is concerned and after screening to detect the chromosomal abnormalities in an unborn baby? Chromosomes are basically thread-like structures which are found in nucleus of each cell. Baby grows inside as these cells are continuously dividing. During the cell division, it is very essential that genetic material, that is DNA, remains intact and is evenly distributed in all the cells. Chromosomes play a key role and they make sure that DNA is accurately copied, but still, sometimes mistakes happen. Changes in the number or the structure of chromosomes lead to serious problems and cause genetic defects in the child, which will remain throughout the life. Thus, it is very important to have screening and detect any conditions if present earlier in the pregnancy. Screening can be by any of the methods we have already discussed. Coming to NIPT, NIPT has a higher detection rate for trisomy 21, that is Down syndrome, trisomy 18 or trisomy 13. NIPT detects 99.5% of the cases of Down syndrome, 97% of the cases of trisomy 18 and 96.1% of the cases of trisomy 13. The results will tell you whether your baby is at high risk of having these genetic conditions or not. There should be a minimum amount of DNA available to detect the abnormalities, and this minimum amount is present from 10 weeks. If the amount of DNA is low, the results may not be accurate. In the next video, we'll explain you all about the diet in your first trimester.